The following is an excerpt from Mind Over Medicine, Scientific Proof That You Can Heal Yourself by Lisa Rankin, MD. There's another category of patients who lie somewhere in between sick people and well people. They're not technically sick, but they're not exactly well either. Their blood tests come back normal, their vital signs are stable, they're granted clean bills of health on their physicals, and yet they don't feel vital. There's an epidemic of patients like this out there. People suffering from this epidemic come to the doctor feeling fatigued. They feel depressed and anxious. They toss and turn at night. They suffer from decreased libido. They gain weight. They numb out with a variety of addictions, and they complain of vague physical symptoms such as muscle aches, back and neck pain, gastrointestinal disturbances, headaches, chest tightness, and dizziness. Suspecting something is terribly wrong, patients suffering from the epidemic go to the doctor knowing something must be wrong. The doctor runs a series of tests and winds up pronouncing the patient well. Only the patient doesn't feel well. Because doctors cannot find a biochemical explanation for the symptoms these patients experience, we tend to treat them with antidepressants and other catch-all drugs that fail to address the root cause of the issues. And the patient often fails to experience relief. So the patient goes on to another doctor and starts the whole process over again because something is clearly wrong. And they're right, something is wrong, but it's not what they think. Many of these patients who are technically well but feel sick are suffering from the psychological consequences of repetitive stress responses that progressively break down the body. Unless the underlying stress is relieved, these patients often become genuinely sick. But the medical establishment doesn't seem to recognize this. Instead, they suggest that the physical symptoms are all in your head. And they're sort of right. It starts in your head, and then it translates into the body. If I'm not pregnant, why am I still having pregnancy symptoms? Feelings of unexpected, not ready, anxiety, fear, and even anticipation about the possibility of pregnancy triggers the HPA axis, activating the hypothalamus and stress response, affecting the body, giving physical symptoms. All this mixed with the body's natural optimism when it comes to conceptions, hormone fluctuations throughout the cycle, and you have a cocktail for the mind translating to the body and the body translating to the mind, back and forth with very little distinction for the woman experiencing it between which system was noticed first, the system of pregnancy, which is the body, or the thoughts of pregnancy, which is the mind. What is interesting is these pregnancy symptoms aren't all in your head. They're real reactions to the hormones in your body that are preparing for possible pregnancy. Women's bodies are very optimistic when it comes to pregnancy potential. As soon as ovulation occurs, the body starts preparing for a new life. This occurs even if conception did not take place, and so women technically experience some level of pregnancy symptoms every month or every time they have a cycle. Reading about or being told you are or will experience an undetected pregnancy can induce fear, anxiety, anger, confusion, frustration, and a whole other range of negative emotions, which would trigger the HPA axis, activating your hypothalamus, releasing corticotrophin releasing factor, which is CRF, into the nervous system. CRF stimulates the pituitary gland, causing it to secrete prolactin, growth hormone, and adrenocorticotropic hormone, which is ACTH, which stimulate the adrenal gland and cause it to release cortisol. When the hypothalamus is activated, it also turns on the sympathetic system, the flight or fight response, causing the adrenal glands to release epinephrine or non-epinephrine, which increase pulse and blood pressure and affect the psychological responses. The secretion of these hormones leads to a variety of metabolic changes all over the body. Basically, your body ignores sleeping, digesting, and reproducing. It's when this stress response is repetitively triggered that nature's biological response winds up doing more harm than good. As a result, the body cannot relax in order to repair what gets ill, leading to more physical symptoms in the body as a result of this neglect over time. Most of the women who believe they are years pregnant fit in the category of patients who technically aren't sick, but they're not exactly well either. These women are suffering from psychological consequences of repetitive stress response that progressively breaks down the physical body. So, when you think about it, stressing out about pregnancy can cause pregnancy symptoms. Is asking yourself over and over and over again if you're pregnant what's causing the problem? I hope this video helps someone, and thank you for watching. Stay blessed, friends. Bye.